Okay, now it's recording.
Right.
Thing. So yes, thank you very much. So the class, Dr. Xenakis, thank you very much for visiting our School of Business and Public Administration at the University of the District of Columbia. Guys, I'm really excited to welcome General and Dr. Xenakis. I'm not sure which way it goes, or Dr. and General Xenakis. Dr. Xenakis has served in the United States Forces, in the Army, and also is a medical doctor, psychiatrist. Very active. He advises commanded, I believe, large commands within the United States military, wrote strategic papers regarding military strategies and related to medical field for the military, advises senior national defense military leaders as well as political leaders. Actually, as this session is over, Dr. Xenakis is being picked up to give a live TV show at Al Jazeera America, and it will be on PBS Live later tonight. So if we have a chance, I'll send you the links. And with that, I'd like to welcome Dr. Xenakis, and I'm really grateful for, allow Dr. McClure. Dr. McClure is the chairman of the management department at our school, runs both graduate and undergraduate programs, and I'd like Dr. McClure to welcome General Xenakis on our campus.
Thank you very much, General Xenakis. As a matter of fact, we're going to use both titles, General and Doctor. We are very welcome to be with us here this morning. I would like to thank you for giving us your time, and I'm sure our students will be very appreciative. We're really very appreciative for your coming. So it is a privilege to have a distinguished guest in this class, and I hope that you will have a repeat visit in the future. Thanks very much.
Thank you so much.
With more students next
Yeah,
time.
well, that's fine. It's a pleasure. All right, well, let's, I'm going to take my jacket off so we can talk.
It's really warm in here.
It is warm. But you know, I think what we'll do is we'll open this up in a give and take, because I know you've gone over a lot of information and you're the brightest of the bright, so we'll have a little conversation today about leadership, and I'll tell you a little bit about how I approach it, and from that, I hope as you go on in your careers, you can learn from my experience as you will learn from other people's experience. You know, we've got a great teacher, a very smart man, and Professor Dr. Ivanov. We've worked together before. He thinks a lot about these issues. He's analytic about them. He's critical about them, and all that's important because as you go on in your careers and your lives, I think you start with being able to ask the right questions and feel like you can challenge almost anyone in a respectful way, but you can challenge them so you can learn, and that's what I want you to do today in the conversation. So let me just give you a little bit of background on who I am and what I do, and then we can talk, and then I'll give you some idea of my approach to leadership, and then we can take the questions. I'm a physician, I'm a psychiatrist. I graduated in 1970 from college and finished med school in 73, 74, so kind of how you calculate that. My college and med school were paid for by the Army, so I ended up having a long obligation and a career, and during that time I spent 28 years in the Army and did a lot of different things, some in clinical medicine and some as a commander. So I commanded hospitals, what would be considered community hospitals, and for example at Fort Campbell, Kentucky, which is the 101st Airborne Division Infantry. And then I had a regional command in a place called Fort Gordon in Augusta, Georgia. Here are golfers, it's the home of the Masters. And that was for all the Southeast. So I had about 15 hospitals and commanders that answered to me. I did a lot of consulting and advising. When I retired, I went on and was the CEO for a couple startups, which is a very different kind of leadership. It was a different experience. And now, most of my work is with soldiers and veterans and detainees in Guantanamo. And so my balance clinical practice, and I've always felt that in order to be a good leader and to be effective as a leader, I needed to have one foot always on the front lines as a clinician. So I needed to be able to get, and I'll talk a little bit more about that. And so I spend about a day and a half equivalent with patients. And I also have decided to conduct some studies and have set up a nonprofit in what's called translational medicine. And it's an old idea. It was an idea 20 years ago that I did in telemedicine. It's sort of like you work at incubator. I see a problem out there now coming out of about 12 years of war that we have at minimum 400, 500,000 men and women. We've had 2.5 million who deployed to Iraq and Afghanistan. So that's individuals. And many of them deployed multiple times. And in the course of those multiple deployments, they have had injuries and exposure to stress and other, encounters that are now they're going to live with and affect their health. And I think that it's a public health problem. And because these people come back to our communities and they're struggling to put their lives together. Not all of them. Some of them do extremely well. But there's a substantial group that struggle to put their lives together. They're coming back home, and they've got, partners and children and other family members, and it just spreads. I mean, it's got a viral impact. And I'd like to see us do something sooner than later. My generation, I'm a Vietnam era soldier, my generation did not recognize that Agent Orange was a problem. And the first reports came out in the late 80s. And even now, we don't really have a lot of, we treat some of the problems. I've had any number of my friends die of leukemia or lymphoma, which I think is one of the consequences of that. We didn't recognize PTSD. In fact, it wasn't even a diagnosis. The war officially ended in 1975, and it was not a diagnosis until the 80s. So we didn't even recognize that as a problem. And then there are other medical consequences that came out of that war. So those legacies have gone on now for 40 years. I think that we can do better with this generation of soldiers, and that's how I've set up this nonprofit. So take things and bring them in and test them out in a very quick way. So it's the application of current technologies to a problem that we have now. I spend a lot of time in defense work, so that because of my clinical experience and my interest in this area, attorneys call me, and some of them are attorneys of who we would call terrorists in Guantanamo, and I've spent months in Guantanamo. And then there are attorneys for soldiers and veterans who will call and say, "Can you help us? We're trying to, put up a defense." I've got one soldier, sad case, 26-year-old man, who, I think what the attorneys are going to try and do is make sure he doesn't get the death penalty. Sad case. So, I feel that my I've got some knowledge I've got a commitment here, and I feel my responsibility is to help. I mean, that's what my job is. That's why I'm a doctor. And then I do some advising. I was telling Sergey I have the privilege of being able to advise the vice president on dangerousness and gun violence. In early February, there was a public service announcement where about 8 of us, retired generals, put on the television, had aired a couple of days, saying that we don't support assault weapons and high-capacity magazines in the hands of the majority of people. We think they should be restricted. They're combat weapons. We see them as combat weapons. We don't see where the average citizen needs to have those weapons. And, I think we have to think really hard in our communities. We have to think really hard what happens to guns and what the dangerousness. And I worked for a couple of years down the street here at the Psychiatric Institute of Washington. And it really is the city's hospital for children and adolescents. I'm a child and adolescent psychiatry, and I saw too many kids come in who have been the victims of guns and violence and abuse. And I think that really rips at the core of our communities. So what I'm saying to you is, I feel that even as a doctor and as a leader, what grounds what I do has to be some ethics and values. And that was something, that in my leadership positions was the start point. Because I, as a doctor, but as a doctor in uniform, my goals, my values are with helping patients. Keeping them healthy, keeping soldiers fit, keeping their families healthy. So if the families are healthy and fit, then the soldiers or the airmen or the sailors, they're fit, and that's the start point for what we do. And that, I think, it's not just the treatment, it's got broad social implications. If you're talking about fitness and health, then you're talking about lots of things that go into it in the society. It's a complicated issue. That paper that I sent was something that I put together, this team, in 1989. We were at the Army War College, and I was wrestling with these ideas in 1989 of now what happens and what are we going to do in our Army when the Berlin Wall has fallen and the Soviet Union is gone, and we had been for decades been thinking about fighting the Soviet Union. So now what does the Army do? We had managed care coming in, and it was going to kind of influence, pressure us in terms of what we were doing. Lots of technology. So where is medicine going, and how do we put these things together and think about what the mission is and understand what the purpose is? Because what the leader does, as a child psychiatrist and as a dad, so for better, as a dad, my job is to bring these people together, to bring this team together, to be going forward in something that everybody thinks is important. So that's point one. You've got to have the right vision. You have to think about it in detail. It's not just a broad mission statement. Sometimes you'll see these kind of strategic plans, and there's a 15, 20-word mission. It's much more complex than that. Not that everybody, how you communicate's another art. Leadership's there's an art to it. It's highly individualized, and then there's some principles, I think, to use. What I'm painting for you, actually, as I'm talking about this, is if you deconstruct what General Petraeus did, in the surge, he fundamentally did the same thing that we'll be talking about today. And he's a good friend of mine. We served together at Fort Campbell 20 years ago. The doctors, the hospital saved his life. He was shot through the chest accidentally by another soldier on a night training mission. And, you know, he's got right on top of it and saved his life. You know, he's a great man. So in the surge, or even in what you're going to do in healthcare, what's the vision? What are we trying to do here? And that requires a lot of thought. The same question comes into Obamacare. What are we really trying to do here? What's the objective? What are the pieces of that objective? Because that's where the going gets tough. There are a lot of pieces to what's going on, and that's what I tried to break out 24 years ago in this paper. There are a lot of pieces. Now, because there's a lot of pieces, the second thing that's important, I think, in leadership is that team of immediate subordinates. The ones working directly for the most senior leader. Those people have to get it. They have to be able to understand the whole big picture and all the pieces, and then grasp out of that what particular sector, what area is most important for them. So they know how to optimize their team or their area to make that effective. And that group has to be really loyal. Now, by loyal, I don't mean yes men or yes women. You know, by loyal, I mean people who are honest, who are ethical, who are willing to be transparent, who are going to engage in conversation, who understand that there's a lot of gray areas, and that we're going to collectively look at this problem, and then finally, at some point, because these are complex problems, somebody makes a call. The boss makes a call and says, I got it, guys, I understand what's happening here, these are all the pieces, but this is the way we're going, and this is why we're going this way. So, and then I will tell you, because I got involved through most of my career, probably because the way my personality is, I got asked to take on organizations that need change. So most of the organizations, hospitals, and sometimes other groups, where I was a transformational leader. I need to make a shift, and that's also the analogy to General Petraeus, because he made a shift in Iraq and the way when he brought in the surge strategy. Shifting organizations, getting them to do new things, to move forward is really hard. People like to do what they've generally been doing. And most people don't like changing their lifestyles. Don't like changing their habits. It's hard. It's uncomfortable. You gotta learn new skills. You gotta change your attitude. You gotta face your biases. So there's a whole bunch of layers between that second tier of people and the front lines. You know when things are gonna happen if you've got an eye on the front lines. And that's a feedback loop. You can't deal with all the other stuff in between. It's too hard, it's too complex, there's too much stuff going on. But if you pick the right frontline things, and this is where some of the theories that Dr. Ivanoff's been talking about, if you pick the right frontline stuff, as your indicator, as your metric, then you know if the changes are happening up and down your organization. You know, this website thing for the Obamacare, it's not just a glitch. It's got other implications. It's got the implications as, was his organization really committed to launching this? You know that there are a bunch of little spies and insurgents in Health and Human Services and the other parts of government that were committed, right? You know, as a commanding officer, you go in and you talk to your troops. In hospitals, half of the staff are civilians, and they look at you and they're this kind of, all right, this guy's here for 2 years, maybe 3 years, he's out of here. I'm here for 20 years. I'm in Fort Campbell, Kentucky. I'm a civilian. I've lived here. I'm a native. You know, these commanders come and go. I do what I want to do. You know, they're going to wait you out. You can't take them on directly, but you can sure outrun them. So, and you have, and that is style. That's just, you got to pick what your particular style is and what you're going to do. I'll tell you a little funny story, then we'll open this up to questions and answers. So at Fort Campbell, I fired my first sergeant major because I knew he was just corrupt. And nobody fires sergeant majors. And, but I said, I knew this guy was corrupt. I had a little intel. My dad, who was retired military, came to the change of command. This was 1990, and it was a great reunion because both he and his twin brother had done basic training there in 1940. And they went around looking for all their old haunts, and I think they were looking for their old girlfriends too, I'm not sure. And so, and my dad, who had been enlisted and then had got commissioned, says, I think you're going to have a problem with your sergeant major. I said, I think you're right, Dad. So I waited my time, waited about 3 or 4 months, and I fired him. And I found stuff. Took a while. You don't do that. The system, they've got their own mafia. And I got this sergeant major who was just really great. And so we just hit it off. He'd been in Vietnam, had a couple tours, just an energetic guy, Army Chief. And African American, but actually about summertime, he and I got about the same color. And, you know, it's sort of, you've got a weird name like mine, and you can get really tanned in the summer. People, I mean, it's funny to be on a psych ward because you'll get some psychotic people look at you and they'll look at you and say, what are you? You know, they can't figure out what's going on, which is okay. I just want them to keep them. And so, Sergeant Major and I would go run. We're both runners. And we took noontime, and we would go run. Of course, I got more tanned, and he, it just. And then we realized the thing for us to do was neither of us would hold meetings in our office. We knew we had key people that we were going to talk to. And as we were going to do our business, particularly in the afternoon, morning times we got tied up sometimes outside the hospital. We would go to that person's office and area. We wanted to see what was going on in the front lines. We wanted to be right there. Well, one day, one of the wives of the senior colonels is sitting there in neurology, and she calls up my wife. She says, Mary, do you know what's happening? She says, no, I can't control him. I don't know what's happening. She said, this hospital has got an underground, and your husband is Tan Man 1, and the Sergeant Major is Tan Man 2. And they have a whole alert because they start seeing them. They see them. They're like these uncontrolled little guys going through the hospital visiting, and they're calling from one clinic to the other, trying to keep spot of where our next touch point's going to be in the hospital. So they were everybody had this little network watching us. That was great. that was great, because I knew that if they're watching us and that we're going to come to the clinic, they're going to start picking up. They're going to start doing the stuff we want them to do. And it was the little things. Like I wanted every patient, active or retired, to be called by their rank. I wanted every spouse to be called, Mrs. or Mr. I want everybody to bring in and understand that we're treating the whole family. I wanted, if you're a clinician, I wanted everybody to wear white coats. I wanted particularly the doctors to wear ties. Even we're at war. This whole thing, it got to me that during the 10 years of war, I would see these generals walking around in their combat ACUs. I said, what are you guys doing? You're in the Pentagon. You should be thinking about what all the implications are of this war. Now, those are little things, but those little things were all part of a bigger program of transforming the organization and bringing professionalism into the organization and bringing respect. Doctors, nurses, people in healthcare, fundamentally, we start with respecting everybody's humanity. Everybody's humanity. Everybody's the same. Everybody. Everybody we welcome with open arms. That's basic to everything we do. Today, as the professor said, today, 12:30, I'm going to tape with Al Jazeera America. And at 7, I'm going to be on PBS NewsHour with Ray Suarez, talking about a report that I've worked on now for several years about torture in Guantanamo and Afghanistan, Iraq, things Americans have done. It's wrong. It's morally wrong. But what, the reason I'm called is because I think it's really wrong, and doctors and psychologists and nurses were involved in torture. They were part of the teams. They crossed the line. You can't walk in and say, because this brown guy might be related to that brown guy who tragically, was responsible for the World Trade Towers, I'm going to torture him. That's crossing. Then you have broken your vow to what you're going to do as a doctor, which is you're going to respect everybody. You can't do that. You respect everybody as a doctor. And you put that ethic all up and down the chain. So that's why this issue is going to come up. Because I think it's a strategic issue for corrective action. I think it's something that's really important for us to understand if we're going to recover our status and be and really lead and protect all of us against these kinds of threats. It's those little things, but and I'll close with that, the leader identifies on the front lines what actions, behaviors, appearances the front line people are going to show it's important that really are directly linked to the strategic plan. And the strategic plan for a hospital or a set of hospitals is to provide the highest quality of care you can to the most people that you can, because you've got a fixed budget. You apply it efficiently, economically, and effectively. It's a complicated issue, but then you've got these indicators all along, and you bring in your team who understand their piece of it. So that's my theory of leadership, and let's just open it up and hear what you all want to talk about. Yes, ma'am.
I have a question. I never asked a professor or doctor this question, but How can you become successful without making any mistakes?
You don't. You make lots of mistakes.
I know it's such thing. I know it's not such thing being perfect, but when it comes to me, I'm the type of person who wants everything to be perfectious. I mean, to be perfect. Sorry.
Oh.
And I know that I'm going to make mistakes, but how can you avoid making mistakes by becoming successful or trying to be successful?
Well, I mean, there are a couple things. You know, I think you spend a lot of time doing word after actions. So every time I do something, and I think the leaders I respect will go back and analyze what they've done and what's worked and not worked, and be as objective as they can about that.
Mm-hmm.
Secondly, I think what's important in order to is to find good mentors, good leaders,
Mm-hmm.
and to pick people who have been effective and successful, and to study what they've been doing, and you have been working for them, and study what they've been doing, and hopefully they're also honest and being able to tell you what's worked and not worked. But there will be mistakes, and there will be serious mistakes.
Understood.
That's my question. All right, too many. I guess what I want to really ask though is what has been, as far as being in the military and working as a civilian, or working with both, as you said, with the military and the civilian in one facility, what's been your biggest struggles or your biggest challenge by having that unique mix? Because you have soldiers that's going to follow your orders because you're a general, but then you have civilians that is just going to, run their life, just like you said, like, oh, I can wait this guy out. So, because he's going to leave, I'm stuck here in this city, and this is my job, this is my career, where we know that military comes and goes wherever they're needed. So what was your biggest challenge? What was as far as leadership goes, of kind of that mix, that civilian?
Well, actually, it wasn't that clean, because first of all, a lot of the civilians are retired military, and you can hook them, and you have a lot of really good people. I was just using it as sort of a sort of illustration, but there are just a lot of good people who felt for the patients. These patients were, their neighbors. You go to Fort Campbell, you go to Fort Gordon, you go to Fort Hood, all these places that I've been stationed, places in hospital. These people are their neighbors, they're family to them. And so if you can get to that feeling, I thought the biggest challenge was understanding and being able to grasp what were their values and be able to connect with them on their values so that they would feel inspired to do the things that I thought was important. And so that a lot of civilians were saying that they're going to help their people, and they're going to be as enthused about it as not. Now, my biggest challenge, because I have a bit of a temper, was controlling my temper, because I can blow up in a minute. It's too bad, that's kind of the way I am. I've been working on it now for many years. And so that's a mistake you learn from, and you know that you figure out when those things are going to happen, when your buttons push. One thing that I find that I just struggle with the most is careerism, is people who are just really self-serving. And it didn't make a difference if they were in uniform or if they were civilians. So that I would get a group, I'd had some officers who, particularly if they were not medical corps, that were other branches. In the military, we've got all these branches. So we've got medical corps, medical service corps, nurse corps, all that. And these officers would particularly see their career path important, that they got aligned with the most senior person in their corps. Well, there's a lot of friction between these corps. And I saw that as self-serving. And my biggest problem was to figure out how I was going to work with people, what we call careerism amongst the senior officers. How they were going to get around their being self-serving. And look, I understand everybody wants to do better. Everybody wants to get promoted. Everybody wants to, have more money to take home. I appreciate all that, and I want that. But I do want some loyalty to the mission. I want some loyalty to me. And my hardest challenge was figuring out when a person was really going to kind of undermine me and sabotage me, stab me. And I'm not real good at that all the time, and so I had to have spies.
Hi, my name is Darnella Adams, and what I want to know is, with respect to you being a hothead, as you say, because you're a transformational leader, and I know that you encountered a lot of opposition in a position such as that, what specific styles of management did you employ to kind of overcome that opposition and to just,
Great question. What I learned to do, it took me, let's say 10 years to learn to do this. I mean, I was lucky that I got as far as I did till I learned it, was when I thought that there was somebody who was really going to directly try and block an objective or goal, I put somebody in between that person and me.
wow, okay.
Somebody who I really trusted and understood, and who appreciated what I was doing and the problems I was having in managing that person. And so what's happened since then, as I've been thinking more about this, I assume, and there's sort of research to indicate that, I assume that there's about a quarter of the people that I'm not going to click with, at least.
Yeah.
And they're just going to look at me, or I'm going to look at them, and it ain't going to happen. So
But there's a goal, so.
that's the way it is. So let's just get that out there, and and let me figure out what I'm going to do. I'm going to make sure that my worst I don't somehow act on my worst instincts.
Okay.
So I'm going to try and be as thoughtful as I can be, as fair as I can be, and I'm not going to let that bias come into play. And that's also the other reason I put somebody in between us.
That was a good, I wasn't expecting that answer. That was a good answer. Okay, so
Well, you can learn, even old guys can learn.
I have one more question.
Last question, guys. This will have to be last question.
I have a question.
Last question, because we.
Okay, so for me, my question is, how do you find transformational leaders, or how do you train them to be that kind of way?
Well, there's, you can find people who are going into jobs, and they're specifically going into jobs because they got to change that organization, and they know. And so there's plenty of broken organizations going on and operations. I'd say in the city, I think that the Department of Education looked to me like it was one of the ones that was being changed a lot here. I mean, I was very far removed from it. But you can find people that will say, and they'll declare it. I mean, a leader will come in and say, look, I'm going to go in to do that. How do you train them? It's a very complex, and every one of these sports is different. Every one of these games, transformations is different.
So with that, guys, I'm sorry, but it's the end. Dr. Xenakis has to leave for Al Jazeera America, and it's a live TV show, and they start promptly at 12:30. With that, if I find the links, I will send them to you. Let's thank Dr. Xenakis for. And, thank you all very much.
Answer my question first.